The maternal and health center at Olodo has now been redesignated as the State Infectious Disease Hospital.
On 21st March, Governor Seyi Makinde declared that the Olodo Center be converted to the main isolation center in the state. For about 4 weeks after that, work went at the center day and night to meet the deadline. The deadline has been met, and now the state boasts of a 100-bed capacity infectious disease center to treat and manage patients who have to get care beyond the isolation centers across the state.
Locally reserved for patients who have been diagnosed and they're coming for treatment, and I'm sure they'll probably be brought in an ambulance from the isolation centers. And then, of course, there's a ramp and a stair, depending. And then there's a resuscitation room, which has 4 beds. Again, those ones have piped oxygens, suction machines, and everything, and monitors to try and, classify the disease either at the triage or at the resuscitation room. And then we take a decision as to where the patient will be best managed.
The COVID-19 task force assures that the center is fully equipped. Resuscitation room, high dependency unit, intensive care unit, and a general ward for male and female are all ready for use.
All appear set at the Infectious Disease Center Olodo to start business, that is receiving patients who have infections from all over the state. And this has been designed to outlive even the COVID-19 pandemic era, because it is the designated Infectious Disease Center, the first in the state to handle such cases. Bukola Oriowo, Channels Television News.
Well, from Kano, we come to southwest OYO State, where we would like to speak with someone there who can talk to us about the fight against COVID-19 in that state. Of course, the frontline soldiers, medical practitioners, and the chairman of NMA in OYO State is here with us this morning, Akin Shodipo, to speak with us on this matter. Thank you so much for joining us. He joins us via phone. Thank you for joining us this morning. From where you stand as a medical practitioner in OYO State and chairman of NMA in the state, how satisfied are you about efforts to curb the spread of coronavirus disease in OYO State?
Well, good morning and thank you very much. As a matter of fact, if you say how satisfied are we in curbing the coronavirus and talking about the preparedness, I would say that neither here or there, we're probably just in between. But fortunately, as we speak, we only have 8 active cases. But the state government has put in place isolation center in Olodo, which for now has not received any patient because there's no patients in there yet. They have an isolation center in Jericho that got some few patients and they've been discharged. Most of the active cases are self-isolated at homes and are being followed up by the task force, I guess. But the response of the task force or the response of the people getting tested was very bad. But now it seems to be a bit better since the state government has started the drive-through test center in Adamasinga. People get tested quite early enough, and the turnaround time for the test is still a bit slow, but it can be better. But now we have more people being tested, so we're expecting that we'll probably look at the statistics over a while after we have enough tests that have been done. Our state government is hoping to test about 2,000 to 10,000, I presume, and they made available health workers to present themselves for tests. People who have been exposed or people who think they must have treated or gotten in contact with the positive COVID cases. And that's just what we are right now. And we're just in there and waiting for it to get better.
That's what we're all hoping for. But you mentioned earlier that the active cases are being managed at home. They're self-isolating at home. It would seem that's a different policy for your state, but can you clear the air on that? How does that work? I mean, we thought once a case is positive, they're taken to the IDH or the isolation center, but it seems it's different in your state. How does that work?
No. I didn't say all of them. Like when the governor tested positive, he wasn't in isolation ward, was he? He was self-isolated at home, and he got over it. I'm sure the CMD, the provost, and the deputy provost got self-isolated at home and he got treated. But that's a waiver from NDCT, that is for the state government to answer. But like me and you know, every tested case should be moved to an isolation center. That is the idea.
Okay. At what point does a case get moved to the infectious disease hospital?
At the point is that it gets seen by the frontline doctor, private hospital, or general duty doctors in A&E with a high index of suspicion. You call the rapid response people, they get the person tested. While the person is tested, ideally, if it's tested and it's been suspected with high index of suspicion, there should be a place where they should have been isolated before the result comes out. This should not mix with the people already positive who are being treated. So if a suspected case now turns negative, it gets out of it because it's just where suspicions are. But ideal thing is once they test positive, they should move to an isolation center where they should be properly taken care of.
Where you stand, what would you recommend now? Would you say that that policy of people self-isolating at home, do you think it's sufficient? Do you think it's effective to fight or curb the spread of this disease? Or you think they should be moved out of the areas where they can also infect other people unwittingly?
Where we stand, or where I stand as a doctor is where NDCD stands. Once somebody is infected, that test positive, it should be moved to an isolation center. You might now decide as a country or whatever to have degrees of isolation center. You know what I mean? Some people are bigger than the others. Maybe you think so. But that it should not be right for anybody to be home isolated because that's not what the NDCG says.
So a few days ago, we had the president of NARD on the program, and he revealed to us that one of their members tested positive for COVID-19 in Ibadan, the UCH, I believe. And it brought to light the protection of frontline workers, doctors, nurses, how well they are protected. We've spoken to the NMA in Kano. We'd like to know what is obtainable in OYO State.
Thank you very much. The protection for the healthcare workers, the frontline workers in OYO State, I will tell you it's almost zero. The protection gears and everything are usually in the isolation centers. But we ask the question, is it not doctors on the front line that will diagnose or foresee these patients before they get to isolation centers? The question is, none of the private hospitals in Oyo State is being supplied with any form of PPEs to even protect them while they are diagnosing most of these cases, since they see about 60% of the patients. Two, most of the general hospitals in Oyo State have barely few protective gears. When we're talking protective gears, we're not talking of the full complement of the gear, the hood and everything. The basic thing that you need to even triage. We're talking of goggles, face masks, hand gloves, sanitizers, water to wash their hands. Most of these things are in short supply. So they are not adequately protected as of now.
I mean, when you say that, it's quite shocking. We don't expect that. Those are the front line. You say they see 60% of the patients are not protected. But whose table is that bulk? Who is responsible for ensuring that the doctors get the adequate equipment, the PPEs they need? Who is responsible for that?
It should be the responsibility of the government, because most of the time, you see, the private doctors are not being supported by one guy, as I speak with you today, in any form of protective equipment. And they're once in about 60% of the patients. So if the government can come to their aid, that will be fine enough. But right now, most of the private patients, doctors are taking their fate in their hands. They have to procure most of these things. They incur so much expenses. The patient turnout is low, so their overhead is increasing. So it's weighing them down. And they're now complaining, for how long are we going to do this? And it will be disastrous if most of them have to shut down. Not that they're on strike, they might have to shut down because they're not making profit and they're not having enough things to protect themselves. That will be disastrous. Where do the patients go? Patients go into hiding, and that will increase our infection rate. And the general hospitals, the buck stops on the table of the state government. The state government is to provide most of these things in the government hospitals, not just in the isolation centers, because they get diagnosed from the general hospital, from the private doctors, before they get to the isolation centers. But it seems all concentration is just on the isolation centers and isolation centers.
Dr. Shodipo, how involved is the NMA in Oyo State with the government in the fight against coronavirus disease in the state?
No involvement whatsoever at all. As I speak with you, none whatsoever. The first correspondence the NMA Oyo State had from the Oyo State government, the letter was dated 28th of April, that was on Monday, telling us that they've seen the activities we have been doing on our own and they are looking forward to calling on us with this pandemic as it goes on. That is the first correspondence we've had from the Ministry of Health and from the Oyo State government, ever since the onset of this pandemic.
You know, it would seem as though this is a trend, because we spoke to the chairman of NMA Kano State. He said the same thing, that, there was just one correspondence and they've not heard anything so far. Seems that's what's happening in Oyo State. What is a standard practice? Really, because you wonder why the government will not carry you along, as it were. Is it standard practice? Are they making up for it in another way? Or what is your view on that?
Well, my view on that is it's something that's funny. If you look at it, even in the national level, the national NMA is not being carried along. I wouldn't know whether it's just the federal government passed down to state government that this is the way they want to do their things. NMA national is not being carried along as well. So it transcends now to us in Oyo State. So we just see that maybe it's the federal government approach to it, but we say we cannot just leave our members to be exposed unduly. So we've taken our fate into our hands and started doing what we can do to protect our members, and we've written a letter dated today. We're sending to the ministry, acknowledging the letter they've written to us and telling them that we demand that our members should be given adequate protections of their lives so that they will be able to offer good and effective services to the masses.
Maybe we should just lay the issues on the table. Yes, the PTF at the federal level has the Minister of Health, the DG of the NCDC. So there's a presence of, medical professionals on that task force. Even across the states also, we understand that commissioners of health are on those task force. What value can the NMA bring to this fight against COVID-19?
What we think we can bring to the table is, look, if you call NMA into this, we have professional bodies, we have specialists in different fields. We're talking of people who are into community medicine and things like that. We will be able to give you advice. We will be able to give you information. We will be able to disseminate information from the EOC, from the task force, back to our members and to the populace. But if we're not carried along, we did not sit down and just be looking at that. We're still making choices. But we're not just being carried along. And it's shameful and it's annoying.
I want to assume that there are members of the NMA in government. I want to assume that the Commissioner for Health is a medical practitioner and ideally should be a member of the NMA. Is that assumption correct? And of what value is the membership of such a government official to the NMA and vice versa in this fight?
Well, the assumption is very correct. The Commissioner of Health is a medical doctor. The Permanent Secretary, Ministry of Health, is a medical doctor. The Permanent Secretary of Hospital Management Board is a medical doctor. There are so many doctors in the ministries, and they're all members of NMA, but it's so shocking that they just all sit down there and do a ministry affair and not even involving the association which they belong as a primary body. They probably just represent the ministry as ministry, commissioner as commissioner, executive secretary of one board or the other. But they are not just getting to NMA. When we've been to them, personally, I've paid visits to them. I've tried to talk to whoever cares to listen, but nobody seems to be listening.
So I'd like also to talk about the measures being taken by the state government to curb, the spread of COVID-19 in Oyo State. 16 cases recorded so far in the state. Oyo State is 6th on that log, just below FCT, Lagos, Kano, and I understand there's a curfew in Oyo State. I know there's been a lot of back and forth about whether to have a complete lockdown, what should be done. But looking at these measures put in place, what more do you think can be done, especially because Oyo State is peculiar, it's different from other states in the country. So what do you think can be done to ramp up these activities to ensure that the spread is curbed?
Thank you. One, the curfew has been imposed. The curfew is between 7 p.m. and 6 a.m. I wish what that will do, because I don't know whether the virus travels at night and not during the day. And the partial lockdown the government has put in place for markets, that they should only open to the essentials. That means people who sell consumables and perishable things, as food items. It has not been enforced. It's in place quite all right. The enforcement is the problem. Thank God the government gave them ultimatum yesterday that if they don't do it in another 6 or 7 days, it's going to have a total lockdown. But you see, it's better to enforce than just to make laws. So what we think can be done is to even enforce what is on ground now. If need for a total lockdown, then we'll move on to that. But right now, if you go around my city, Ibadan, at 10 a.m. in the morning is business as usual. Everybody is clustered, no social distancing, nothing, and nobody's enforcing such. So it makes you to wonder, why the curfew at night if you're going to cluster in the morning?
You're saying that the curfew, or in fact, it should be a lockdown entirely. You think that having a curfew at night is not as effective? Is that what you're saying?
I don't think it's effective. I don't think it's effective. Even during the day, the enforcement of partial lockdown, that means only shops or people that sell food and things should open, it's not been effective. You go on the road, you see people selling shoes and bags. I don't think that's an essential commodity. People selling recharge cards, people selling building materials, fully open and everywhere is there, and there's no enforcement. So we now wonder, how are you going to even enforce the curfew at night? I'm not there to go out. I've gone out once just to see what it is. It was total harassment of innocent citizens on the road for nothing, not really enforcement. We think if enforcement is done, things could be properly done, and if NMA is brought into it, we'll give them pieces of advice we have. We can disseminate this. These members working in the forefront are our members. We need to represent them. We need to give you their feelings. We need to let you know what it goes on. We can sit down around table. We are not trying to hijack the task force or the EOC. No, we just want to have representation there that will be from NMA, not just because he's a doctor, so that we can rub minds together and we can achieve something positive in Oyo State.
And this is largely talking about Ibadan, and not to talk of so many other cities, other towns in Oyo State. What, in your opinion, is the extent to which communication about COVID-19 has gone all over Oyo State? What kind of feedback are you getting from your members or from people around other communities and towns in Oyo State?
Well, the communication has gone a long while. That means I'm talking about radio jingles, posters, making noise about it. It's only a deaf and dumb person who said he has not heard about COVID-19 in Oyo State. That's one. Two, we're talking of this drive-through test and everything. Everything is concentrated in Ibadan. Ibadan is not the only town in Oyo State. There are people in Okeogun. There are people in Shaki and Shepeteri. How much tests are we doing there? How much care are we giving them? The state government says they're going to have an isolation center somewhere in Okeogun. There's one in Ogbomoso, that's the Lautech Teaching Hospital. There has to be so many in different parts of the state. I know Ibadan is the largest, but if you are just testing in Ibadan and you are living upper Okeogun, we're not doing much. We need to reach to these guys. We need to reach to the grassroots up there so that we'll be able to capture everybody so we can have a correct picture of the incidence rate of this COVID-19 in Oyo State.
So for you, the communication is out there, it's popular, but it is not effective. Is that what you're saying?
Yes, it is not.
for your work and all that you have told us this morning. Dr. Akin Shodipo is Chairman, Nigerian Medical Association in Oyo State. Thank you so much for your time this morning. Well, we're back in a moment to take some of your feedback. Please stay with us.